Hi, I'm Macomb County Treasurer Ted Wahby, and welcome to our program Inside Macomb. I have John Gwynn Proser, who is with Healthcare Partners.
Yes, sir. Health Partners and the Coalition Protecting Auto No Fault.
Okay, great. And then we have Damon Sorensen, who's the Chief Financial Officer at Mount Clemens Regional.
That's correct.
And
Thanks.
we want to thank you both for
Good to be here.
for coming here. We had a lot of controversy on a new House bill that's out there, Bill 4936.
Yes, sir.
And hospitals are, and this is to deal with no fault. I'm going to ask you to give us an explanation of this thing and where you see it going and what is it all about.
Well, House Bill 4936, and for citizens that would like to look that up, you can go to michigan.gov and go to the House of Representatives and pull up 4936 to read the 45-page bill. Essentially what it provides is a proposal to dismantle the auto no-fault system that we've known here in Michigan for 38 years. The fact of the matter is they're asserting that the fund that we utilize, the Michigan Catastrophic Claim Association fund, where every driver pays $145 per car per year, the insurance industry is asserting that that fund is unsustainable. Now, they haven't revealed the methodologies behind their assertion. We happen to have some strong insight into what the actual actuarial model is that they're using, but they have, through their spokesperson, Kevin Clinton, our insurance commissioner here in Michigan, indicated that A, they don't have to tell us, and B, they're not going to tell us. The net result of this, Ted, would be that it would kill thousands, tens of thousands of highly paid, highly skilled jobs in the #1 growth category in Michigan for the next 20 years, which is healthcare. It would also cause a monumental cost shift to Medicaid, which does not provide any of the services that are unique to auto no fault. A lot of people don't realize that if you're injured in an auto accident and you need it and you want to live at home, you can get home modifications, electric wheelchairs, ramps, hospital beds, around-the-clock nursing care, aggressive, persistent therapies. None of those benefits are contained in the Medicaid program in Michigan. And Medicaid is frankly breaking the budget of the state already. We're around 25% of our entire state budget is dedicated to Medicaid right now. So kill jobs, a cost shift to Medicaid, and then most unique is the singular governmental regulatory intervention proposed in the bill to impose a fee schedule on healthcare providers in Michigan. The fact of the matter is the Coalition Protecting Auto No Fault opposes this just as a matter of principle, but certainly for those specific reasons. We don't want to kill jobs. We don't want to cost shift to Medicaid. And the fact of the matter is, relevant to the personnel that work in the healthcare industry, we need to be able to pay nationally competitive wages here in Michigan, which means we need to be able to run our businesses and do that in a manner that we are comfortable with, knowing that we can generate a profit at the end of the day for our quality services. And that's after we've paid these fine professionals to be the skilled caregivers bedside, taking care of patients that are catastrophically injured.
You, as the CFO of the hospital, McLaren, are certainly concerned about this. What's the impact, you think, on the hospital? Especially reading some of the stuff that's been out there, they say this could kill trauma centers.
Well, absolutely. The impact to Mount Clemens Regional Medical Center, it's a pretty easy computation because they're proposing the workers' comp fee schedule rates, which have no correlation to these more acutely injured auto accident folks. But the impact to our organization alone is almost $4 million. And we're the only certified trauma center in Macomb County, which means we have trained professionals on site 24 hours a day, 7 days a week, which when you start seeing reductions in reimbursement to that degree, we will really seriously have to assess whether we can continue to do that. We may have to change that 24/7 access, which, as you know, when you're injured in a serious auto accident, time can mean the difference between life and death. And so that's a very serious fallout to this legislation that could impact everybody in Macomb County.
Absolutely. And I'd just like to add to that, there really is no good moral reason, ethical reason, or financial reason to do away with the system as it stands. Right now, in Michigan, we have $14 billion in our catastrophic fund. That money is funded exclusively by drivers for drivers. In other words, insurance companies don't put any money, not out of their pocket, into that fund. It's there just from drivers. So like Mr. Damon said, the fact of the matter is this legislation and this reality in Michigan doesn't matter until it happens to you. And at the moment that it happens to you or somebody that you love and you suffer a brain injury or a spinal cord injury, you immediately need to get to a level 1 trauma center just to save your life and become stabilized. And at that moment, having those resources mean everything. Let's look at the contrast. We have $14 billion in our fund. We're the only state in the country that has this unique model, and other states are looking at adopting this model at this very moment. And the fact of the matter is, every other American, 600,000 brain injuries in America every year, 50,000 spinal cord injuries, they go bankrupt. They get subpar care because they don't have the resources to pay for aggressive, persistent therapies or even trauma care. So those people are going bankrupt, they're falling to Medicaid, and they're not getting cared for in the proper way. Our legislature in 1973 had the unique, singular wisdom of crafting this model that has worked so fine for 38 years. So the Coalition Protecting Auto No Fault, Ted, believes that this is wrong on every front, and we encourage citizens to go to our website and drill down and get more information. There's thousands of pieces at this website. It's called dothemathmi.org. dothemathmi, short for Michigan.org. And you can go there and see the legal analysis by George Sinus. You can see the financial analysis by Bernie Birnbaum, who indicated our insurance companies are very profitable. They're doing about $12 billion a year in premiums and netting 25%. There really is no good reason. This, in our opinion, is nothing more than a greedy grab for more profits by insurance companies.
Well, what is Senate Bill 649?
Well, that's actually a mirror image of House Bill 4936. 649 was introduced by Senate Insurance Committee Chairperson Mr. Joseph Yoon, and it's word for word the same document.
Same document.
That's right.
Okay. Well, I mean, you can see then, you know, the impact not only from cost but from the risk of giving proper treatment to trauma patients. If that thing goes by the wayside, you're going to start affecting lives.
Absolutely, I think so.
So what do you, reading some of the stuff that's out there, they said they're still going to try to ram this thing through, and they expect that it'll be voted on early 2012.
Well, they've been saying, you know, remember, there's been several bills. There were House Bill 293 and 294 1 year ago, or 14 months ago, and they were proposing the same thing then. They waited, the insurance industry did, to get to the point of the new elections in the fall, and then they thought they could somehow influence in a speedy fashion the newly elected, which are immersed in 200 topics and might not drill down on this topic. Interestingly, I don't think the House is close to finding passage of this bill at the moment, and I don't think that's going to happen anytime soon, insofar as the insurance industry has told the legislators, we are not going to give you the financial information. They were astonished. They had a meeting just a couple of weeks ago, just before the Thanksgiving break, and our insurance commissioner, Kevin Clinton, hosted the caucus, and all of the legislators went to the meeting and said, what about this, and what about this, and what about this? You know, tell us what your actuarial model is. Tell us where your investments are of our money. And they were told that we don't have to tell you that, and we're not going to tell you that. So I think that offended a great many legislators who, on the one hand, might have considered maybe there is some need for reform. But the other issue, of course, is this is one component. You know, we spend about $1,000 on average in Michigan for our PIP policies, for our auto insurance policies. That's an average. And our PIP portion, which is personal injury protection, which is the part we're talking about, putting our industries of healthcare at risk, and the jobs that are in those industries, that's about 15% of your policy. That's it. And they say the sky is falling, it's unsustainable. Well, okay, what about collision? They don't want to talk about collision, but in fact, if you look at the escalating costs associated with collision on a national basis, that's really where our insurance companies are experiencing what might be described as growth in costs. But again, without full transparency, without them coming to the table with honest intentions to sit down and explain exactly what they're talking about and why they believe what they assert, I don't believe that the legislature is going to make this happen.
I was reading a paragraph in here, this was on the Cranes. The cost for procedures and treatments that hospitals currently charge no-fault patients is significantly higher than what they accept under other types of insurance system, which is a fee schedule. It's not fair that no-fault patients are charged up to 400% more for tests and procedures than workman's compensation patients. You believe that?
Well, I think the fee schedule patients they're talking about are basically Medicare and Medicaid, I believe.
Yes.
That's our major fee schedule books of business at hospitals, and those two payers, which basically dictate the payment rates to us, don't even cover our costs. Medicare on average covers about 90% of every dollar that we spend, and Medicaid's even worse. We may get 50 or 60 cents, and we're losing money every time we see those patients. So to say that those are comparable things to look at is not really a very good assertion.
So this is not a fair assumption.
Well, I would like to add to Mr. Damone's statement that that's actually a deceptive assertion, and I'll tell you why. As he indicated, the hospitals are operating at a loss, and those are government programs that are dictating what they're willing to pay. There's no negotiation. The fact of the matter is, under the federal law, hospitals and all other healthcare providers are required by law to bill everybody exactly the same. So everybody's being billed exactly the same, and you've got the insurance companies coming along saying, look, we're making 25% on $12 billion, but that's not enough. We want to make more money, and we want to do it on the backs of the providers and the backs of the citizens. And that's just wrong. The fact of the matter is, frontline providers like hospitals, home care providers, rehabilitation providers, durable medical equipment providers, they're frontline service providers. They deserve to make a profit as much, if not more, than an insurance company who virtually does nothing for people. They hold the cash, they invest the cash, and they write checks. It's called a third-party administrator. So if we're going to talk about fairness, to quote them, or equitable use of the resources, remember the important part about our system is it's funded entirely by drivers for drivers. One of the sneaky little provisions that they put into this bill, which is patently offensive to most people I've talked to, myself included as a veteran, is that they want to take away our right for public referendum and ballot initiatives. They snuck a sneaky little provision in their appropriations element that would cause the state to spend a few bucks, which would insulate us citizens from the ability to find recourse if they were to pass this kind of a bill. That's got a lot of people incensed. So it's interesting that they use words like fair, when in fact, these insurance companies, the dominant ones, most of them are operating from out of our state. The system is funded by drivers for drivers. It's the only system in the world that has $14 billion worth of excess reserves put there entirely by drivers. So let's ask the citizens, if you were injured or somebody you love was injured, what would you want? Would you want to be able to go to the Level 1 Trauma Center at Mount Clemens General Regional Hospital and get fine care from skilled professionals and allow them to earn a profit, to stay in business and serve the community? Or would you want to worry about whether or not insurance companies make another buck? I mean, that's really what it comes down to.
Well, I think the public needs to understand that, but I think our elected officials need to understand that, because I mean they're going to make the decision, and obviously once they make the decision, you'll play hell trying to change it.
Well, that's correct. I think it would be an almost insurmountable obstacle to overcome. I think we could do it through a referendum, a ballot initiative, but I think you hit the nail on the head, Ted. If listeners want to get involved, if you could just call your legislator, call your senator, call your representative and say, I'm against this idea. Just make that call and or write a letter or go see them when they have coffee hours in the district and say, you know what, I'd like to see the evidence from the insurance companies of their assertions that the sky is falling and this is unsustainable. I'll tell you, we know what the actuarial model is that they use. It's 105 years from the date of injury. So what they're saying is a 35-year-old male is paralyzed in an auto accident, and they're going to have to pay bills for his care for the next till he's 140. Well, how realistic is that? I mean, we know from the Center for Disease Control the average life expectancy is 80 years in
That's
America.
right, and that's